Hey everybody, Dan here with Pain Free You. Today's topic is going to be, why do I hurt worse after a doctor visit or treatment? So I'll get to that in a minute. Let's take a couple of breaths. Breathe in something positive and exhale the negative. Breathe in the certainty and the clarity. Exhale the doubt. Breathe in the knowledge. Exhale the confusion. All right. So why do we hurt so much more after a doctor's visit or treatment? And treatment can include virtually anything, whether it be a medical treatment, injections, manipulations, chiropractic, physical therapy, you name it. And there's all sorts of types of treatments. And a lot of people report feeling a lot worse afterwards. Sometimes there's a little bit of relief, but then later, not so much. A couple examples, people saying, oh, I went to physical therapy and they worked my body, but next day my entire body hurt. Or chiropractic, the next day I was in so much more pain. Or I went to the doctors and they told me the results of my MRI or the x-rays or the imaging studies, and my pain skyrocketed. So why does this type of thing happen? And if it's happened to you, comment below. Tell me your story as to, you went for medical care, whether it be an investigation, an evaluation, to discuss the imaging study results, or to actually have a physical treatment done. And so when you do that, and then you experience a spike in the pain levels or discomfort, why does that happen? I believe it all boils down to perceived danger. And so if you're told by a medical professional or a physical therapist, a chiropractor, acupuncturist, whomever, even a massage therapist, ooh, your muscles are really, really tight. Look at them here. If you're told by any of these medical professionals what's wrong with your body, and then your pain spikes the next day or the next hour or in the moment, it's because of fear. It's because of the perceived danger that you are receiving from them. You're trying to convince your brain that your body is okay, but yet you're still going for treatments. And those treatments seem to be making you worse. And the reason for that is because the brain gets confused. So you've been reading these books about Dr. Sarno, TMS. You've been watching Dan's videos about perceived danger, pain, mind-body syndrome. You're trying to convince me, the brain, that the body's okay, but yet you're still going for physical treatments. And every time you go to the physical treatments, they'll look at you and they'll tell you all the things that are wrong with your body, and we think it's this, we think it's that. You get all sorts of crazy, fancy medical labels with 18 consonants and, lots and lots of words. Then you go online and you Dr. Google and search for what those medical diagnoses mean, and there's all sorts of negative data out there, and it's a huge, massive nocebo. Nocebo is the opposite of placebo. And so that's why your symptoms can spike after a doctor's visit or treatment. And so it's really, really common, first of all, and the reason for it is simple. If the pain or the other symptoms are as a result of perceived danger, these medical visits, these treatment visits, increase the perceived danger and therefore increase the symptoms. So number one, don't be surprised if that happens. Number two, that really points us back all the way to Dr. Sarno's, one of his core 12 daily reminders, or 12, Dr. Sarno's 12 daily reminders, which was stop physical treatments. I mean, he was dead on the money with that. And if you've experienced physical treatments making you worse, this is why. Dr. Sarno was right. Physical treatments, even if it's heat or ice or seat cushions or whatever. These things will teach the brain or convince the brain that this is a body problem. And as long as you think the pain is coming from a problem with the body, what do you think the perceived danger is? It's going up. What do you think is going to happen to the pain? Likely to go up. Once you've done the assessment and determined that the mind-body syndrome, TMS, perceived danger pain, is what is causing the symptoms, continuing to do physical treatments of any type is just going to delay recovery. So, simple message, simple suggestion. Once you know it's TMS, stop the physical treatments. If you're scared to do that, then gently wean off of them. In other words, if you've been using a seat cushion for a long time, start using it less. Take it away, go without it. Visualize yourself first sitting comfortably without it, and then gently wean yourself off of it, just like you would any medication. If you're weaning yourself off of medication, do that with your doctor's advice and guidance. I'm not telling anybody to stop medications. Medications can be beneficial while you are teaching your brain that you're okay. Again, zero recommendations here about medications. If the medications are helping you, then by all means continue. If you'd like to stop, work with your doctor. I'm not telling you to stop medications. But I am telling you that the ice and the seat cushions and the various physical treatments, probably not a great idea. Why? Because treating the body for pain that's created in the brain is kind of destined to fail. So I'm going to wrap this one up. Love you guys and gals. Hope this makes sense. And comment below and let me know whether or not you've experienced your symptoms escalating as a result of doctor's visits, diagnoses, or any type of physical treatments that you're doing. If so, that's usually a really, really, really strong piece of evidence that the brain's creating the pain. The perceived danger is what's causing the pain and causing it to increase or stick around. So I hope this was helpful. Love you guys and gals. We'll see you tomorrow. Take care.